what traditional rehab gets right, and where XR can help bridge the gaps. By Emily Davis, PT, DPT. After 14 years in the clinic, I'll be the first to say, traditional rehab works. I've seen firsthand how skilled therapy changes lives. I've also seen the barriers, limited time, fatigue, disengagement, and access challenges. That is why I believe XR is not here to replace what already works. It is here to build on it. With the right design, XR can extend therapy beyond the walls of the clinic, make practice more engaging, and open the door to possibilities we could not reach before. I am confident that the future of rehab lies in this blend of proven foundations and innovative tools, and that future looks incredibly hopeful. What rehab gets right? Task-specific, repetitive practice. Traditional rehabilitation thrives on specificity and repetition. We know from Kleem and Jones, 2008, that neuroplastic change depends on both practicing the skill itself, not just generalized exercise. In neurologic rehab, this principle shows up in gait training, constraint-induced movement therapy, or vision therapy. But the same logic applies in orthopedic and cardiopulmonary rehab. Therapeutic alliance. The human connection remains central. Coaching, cueing, and accountability drive adherence and quality. This applies across diagnoses, neuro, ortho, pediatrics, and chronic pain. Research consistently shows that therapist-patient rapport predicts outcomes as much as the exercise itself. Evidence-based frameworks. Guidelines like the AHA/ASA stroke recommendations emphasize intensity, functional practice, and interdisciplinary care, but the same themes show up across disciplines. Musculoskeletal guidelines highlight progressive loading, function-specific tasks, and adherence, APTA 2017. Cardiopulmonary rehab frameworks emphasize intensity, aerobic progression, and behavioral support, AACVPR 2020. Chronic pain frameworks focus on graded exposure and cognitive behavioral integration. The gaps we all see. Not enough repetitions. Observational studies show surprisingly low counts of purposeful upper limb reps per session in standard outpatient care, often approximately 30. Lang et al., 2009. Limited feedback and variability. Busy clinics can make precise knowledge of results and performance hard to deliver every rep. Curious Review, 2021. Adherence and access. Travel, cost, and boredom reduce home exercise follow-through. Engagement is a real barrier. JMIR Formative, 2023. Where XR helps. Dose safely. One of the biggest barriers in rehab is time. Patients might only see their therapist for a handful of hours each week, yet recovery often requires dozens, sometimes hundreds of hours of practice. A Cochrane review, Laver et al., 2025, shows that VR has greater benefits when it adds therapy time, not just replaces it. With XR, patients can accumulate those crucial extra minutes of practice, whether in the clinic between hands-on interventions or at home between visits, without compromising safety. For the patient, this means they don't feel abandoned between sessions. For the therapist, it's reassurance that progress is continuing, even outside the clinic walls. Feedback at scale. Feedback is at the heart of motor learning. But in a busy clinic, it's impossible for therapists to provide constant, real-time cues to every patient. XR can close that gap by embedding visual and auditory cues directly into the activity, reminding a patient to shift their weight, keep their eyes steady, or reach a little farther. Performance dashboards take it further, giving both patients and clinicians an accessible snapshot of progress. Reviews, like one published in Curious, 2021, highlight how augmented feedback accelerates learning. With XR, this principle is no longer limited to high staff or research settings. It's suddenly available at scale, giving every patient the coaching they need at the moment they need it. Motivation mechanics. Therapy is work, and sometimes it's frustrating, painful, or just plain boring. Adherence often comes down to whether a patient believes the exercises are meaningful and doable. XR can transform this by weaving in gamified progression and immediate visual feedback. Studies, Da Silva et al. 2022, suggest that progress visualization is one of the most powerful adherence drivers. When patients can see how far they've come, they're more likely to keep going. The key is anchoring tasks in real function. For example, instead of simply practicing repetitive reaching or shifting, a patient might move through a sequenced bathing routine in a virtual shower chair, all set within a calm, beautiful environment. The task is clinical. It's retraining the motions of self-care, but the experience feels meaningful, even uplifting. This blend of purpose and immersion turns a demanding exercise into a step toward regaining dignity and independence. That combination of play and purpose is often what helps patients push past frustration and stay engaged in their recovery. Telesupervision? Access to rehab is unequal. Rural patients, those with transportation challenges, or people balancing jobs and caregiving often struggle to attend sessions consistently. XR opens the door for telesupervision, allowing therapists to guide, monitor, and adapt programs remotely. When designed thoughtfully, these programs can maintain safety standards while extending care beyond geography. Instead of gaps in care, patients experience continuity, and therapists gain tools to support them even when face-to-face sessions aren't possible. It's not about replacing the clinician. It's about making the clinician's reach longer and more flexible. Bottom line, traditional rehab will always provide the why, the science, the clinical expertise, and the human connection that drives recovery. XR strengthens the how, giving patients a way to practice more often, with richer feedback, and in environments that feel less like a clinic and more like a journey. As we look ahead, the future of rehab is not about replacing therapists with technology, but about empowering them with new tools. It is about making treatment more engaging so patients actually complete it, more personalized so progress feels meaningful, and more accessible so no one is left behind because of distance, time, or circumstance. The promise of XR in rehabilitation is simple yet profound: to help people reclaim their independence and quality of life faster, with greater confidence, and maybe even with a sense of joy along the way. That is a future worth working toward, and it is already beginning to take shape.